Hello and welcome to Scenar Cosmetology. Today we're going to show you how to use the Scenar electrodes, which will be connected to a Scenar device. So here's the Scenar device, and it plugs into the side here, nice and simple. We turn the device on, and we'll keep it at quite a low setting initially, but the idea is that you find the right level for the patient so that they see a slight feeling in there, but not one that's painful. Okay, so the first position we're going to go through, and this is actually a 13-point program. So the first point we're going to go through here is just one above the eye and slightly below the eye. The idea here is it's going to lift the eyebrow up by pulling the muscle in that direction and pull the eye across as well, so the upper eyelid and the eye will pull it all in that direction. I think if you can have a look at the eye, you'll see how it's making the whole thing constrict slightly. That's just pulling the muscles and working them. As we grow older, we get atrophy in our face, and that's really what causes the aging effect, that muscle loss. So then the next group that we're going to work with is just by the eye and the things that are here. We're looking to pull the muscle below the eye and the cheekbone across towards the electrode. We should see a slight tightening below the eye and into the cheekbone as well. Now typically we'll be working these for sort of 10 to 15 minutes in each of these positions, just to work them through. The next position we're going to show you is pinch into the nose and up onto there as well, and this is quite an effective one. In here we will see a pinching of the nose, I'm just going to come a little bit here, and at the top of the eye as well. So you will see again the cheekbone here will have a tightening. You can see the eye here at the top now tightening as well, and pulling that and strengthening that muscle. The nose and to the side there, so we're pulling those muscles to make that tight, and the top lip as well. So as we get older, the top lip tends to lose its muscles through atrophy, and this just allows you to reverse that process and keep those. Okay, so the next position we're going to move to is just on the outside of the mouth and onto the cheek as well. This is really going to focus on that top lip. Okay, so we're going to pull the top lip and that muscle around that area much tighter, and also it'll pull the cheekbone up and out as well. So we have that nice high cheekbone effect, and we'll see from the mouth as well, again the muscle at the top of the mouth pulling, it just pulls more. As you can see that now, there it goes, it's pulling more and more towards there. And again, in terms of comfort levels, just going to ask the question really, I mean, what are you feeling there?
It's just tightening of the face really, and it's just a tingling sensation you get through.
Fantastic.
Your face.
Okay, excellent. Now we're going to move down to the neck area. And the idea of this is just to strengthen the neck muscles and tone them to keep that area, and also it'll work just below, so where they have that double chin effect. So you'll see there's
you can feel the tightening just from
below the chin all the way down.
Yeah.
Fantastic. So obviously you would do this and mirror it on both sides of the face, but again, so that's going to get rid of any sagginess below the chin, strengthens the muscles and works from there. And the final one I'm going to show you today is just on the lower lip. Again, very important. As we age, the lips tend generally, I think if you look at the older woman, to become thinner. Again, this is through atrophy and loss of muscles in those particular areas. So if we just zoom in here, you can see how there's a tightening across there, muscle on that lower lip, and a pulling down and out of that lip as well to give it that fuller effect. This really is going to pull and work those muscles and allow you to keep that fuller lower lip. We've already worked on the upper lip as we said before, and this works on that lower lip to give that full effect. Fantastic. Okay, so this is part of a 13-point program, and we hope that's been useful insight into Scenar cosmetology.